Hey folks, welcome back to the channel. So it's been a little while. I haven't made a video in a little while. Just Christmas insanity, so just busy with family and things like that. I got a little sick over the Christmas break, so recovering from that, nothing big. But I just want to give a quick update. So I'm on day 52, I think it is, of my peptide therapy. I am now at 750 micrograms a day of BPC-157 and 750 micrograms of TB-4. And the TB-4 I inject only at night right before I go to bed. The BPC I inject 2 times a day, so 375 micrograms, once in the morning, once in the evening. And so I'm on day 52-ish, I think is about right. And I've been slowly increasing kind of the dose as I go along to see, if it maybe helps speed the recovery or maybe my body's just kind of getting used to the dose a little bit. So I've just been, kind of increasing slowly, nothing insane. And I'll say I'm very, very pleased with how things are going. I just finished up my 6th or 7th physical therapy session, plus the peptides, plus doing a lot of exercises with these TheraBands, just continuing to do those Tyler twists, some other kind of cool things that the therapist kind of show me, how you can kind of take like a ratchet and, put your arm flat on a table and kind of move it like this and really stretch out that forearm. That seemed to help quite a bit. They also did some dry needling. I felt like that may have had more of a negative impact on it than a positive one. So probably won't be doing that anymore. It just, for 4 or 5 days, I was really hurting in that arm. And as far as like the healing goes, I think I'm probably, about a 2 to a 2+ pain in the left arm, which is where the pain kind of started. It started in this arm first. And then probably like a 3 or a 4 in the right. So if you've, travel back in time, like 52 days when I started, or I guess it was maybe early November when I started the BPC therapy, I was at a 7 or 8 in both arms. Like I couldn't squeeze anybody's hand. Like I couldn't shake hands with people. It was very painful. Hardly working out, just can't really hold dumbbells. And I've gotten now to the point to where I can squeeze, like a stress ball or something like this without virtually any pain. So I consider that to be a major improvement. It could be the physical therapy plus the peptides, I'm not sure. But all I know is like I've had this for 6 or 7 months now, especially in the left arm. And the amount of healing I've seen in the last 2 months has been pretty awesome, like better than the other 4 or 5 months. So, I think it was a good move to stay on the peptides. So I think it's going to be about 20 more days of the peptides. I'm going to go a full 10 weeks and then just be off for 10 weeks or so, and then see if I need to repeat, see if the pain comes back. Not real sure what to expect there, but so far, things are good. Like I can do some dumbbell work. Haven't tried to push it too much. I've also tried to be a little bit smarter about when my typical lifting split is a typical push-pull legs. So I do a lot of bench press, tricep press, and then the next day I do like a back, so that's pulling bicep work, and then a leg day. I've now kind of split it into like a 4-day split. I do like a push-pull legs arms type split. And I noticed after 2 days or so of doing some lifting that involves grip and things, it gets a little sore the next day. And so I've noticed that what I think I'm going to do is maybe take a rest day kind of between those 2 arm focus days, and just take a day where I don't lift with the arms, or maybe that would be a leg day or maybe even a rest day, and just kind of give it some time to heal before I then start pressing again or pulling again. But pain during exercise really doesn't happen. Don't really have any pain while I'm exercising. A little bit of soreness afterwards, like just kind of tenderness, but no big things there. But yeah, things are going good. So I'm pretty happy about the results with that. Hopefully here in a couple weeks, I might be pain-free in the left arm. We'll kind of see, but things are going good. So if you have any questions about peptide therapy, I'm happy to kind of give you as much information as I've been able to come up with. There's just not a lot of official information out there. There's a lot of speculation and, hey, I tried this and things like that. A lot of people talk about, just inject in your stomach because it's systemic. I've been injecting in my arms specifically, like mainly focusing on the left arm. But lately, in the last 2 weeks, I've been injecting in the right arm to kind of maybe help, because the left arm's definitely ahead of the game as far as healing, but it was also hurt first. So I just started doing some injections in the right arm, alternating. So the BPC goes in the left arm in the morning, and then TB and BPC goes in the right arm at night. And that seems to be an interesting kind of way to do it. It's all experimental. Like, nobody really knows if this stuff works or not, but I don't know. I'm a believer. As far as cost goes, that might be something I'd talk about. I'm probably in about $500, probably for about 6 or 7 weeks now of injections. So it's definitely not trivial, but when you consider some of the alternative type things that you may want to get, like, PRP or that platelet-rich plasma injections, that can be $1,000, $1,500. And so that, for $500, I figure, and I'll probably be about $700 for the full treatment. So that's probably about what you should expect, is about for a 10-week treatment at these dosages, probably about $700. That's not including backwater, which you have to use to reconstitute the mixtures, or syringes, but that's pretty nominal, like maybe $50 for that stuff. I do use a lot of syringes, like 3 a day. So, you burn through those pretty regularly. I've had to order that a couple times. But side effects, the anhedonia has been definitely pretty prevalent throughout, although I notice it less now. I don't seem to have any sluggishness or tiredness or anything like that. That's all kind of subsided. Tooth pain, just a couple things, but not, that might be from the TB-4, but nothing big and nothing sustained for more than a day. So all in all, it's been a pretty positive experience. I would definitely recommend, if you have a nagging injury or you have a short timetable to try to heal on something, it might be something that you look into. Definitely, if you're not comfortable with injecting yourself or any of this stuff, definitely work with an alternative medicine doctor. There are doctors out there, but it's going to cost you more. And there's risk, of course, too, because the good old FDA banned, BPC. So that's, it makes it a little trickier to get. But anyway, if you have any questions, put them in the comments. Feel free to ask me anything you want. I'm happy to answer, except for where I got them. That'll get you banned, so that's not cool. But, ask me if anything you want, and hope things are going well for y'all. So hope everything's going great. Hope you had a great Christmas if you celebrate that. Hope you have a great New Year's. And other than that, keep up the great work. I know you can do it. I'll see you in the next video. Thanks. See ya.